I want to thank Roberta for setting me up with Allison and your whole organization. I've read up on you all, and it seems to be a really beautiful experience from the get-go. And to have all of you wonderful people here tonight it really is exciting for me. I have a friend here with me tonight. She's going to be my model, and she's just been diagnosed with Hodgkin's lymphoma about 2 weeks ago. This is Leanne. She's here. And so there's something that we all have in common, and we've all experienced the Allison, you were there, so I'm gonna go to full screen. No, gonna go back. Okay. I don't know. Anyway, so if you have questions during any of this tonight, hello, who are you? Azella, you're there. You go. Hi, Azella. How are you?
I'm doing well, thanks.
Why don't you all do a roll call so I can just see what your faces look like, if that's possible. So Azella's on. Can we? Let's go to Allison. You've been on. Jerry, have I seen? Yeah, Jerry, you were on, right? Can you just wave one time to everybody, or to me?
Jerry, you're gonna have to unmute yourself because on David's screen he has to hear sound for you to pop up. So just unmute and say hi.
I am here.
There, okay.
Eating a bowl of.
You're eating a bowl of what?
I'm gonna eat a bowl of curry that I made.
Oh, curry. Okay, I thought it was like Cheerios or something.
Not Cheerios, no.
I love Cheerios. Okay, there's somebody that's heard. Their name is Phone.
I know. Can we see who's under iPhone?
Yeah, that's me, Maria.
Maria. Okay, wonderful.
Yeah.
Hi, Maria. Where did you go? I saw your chin.
Oh, okay. I'm trying to get some work
hi,
done while I'm
Maria.
talking
How are
to you
you?
guys.
Good to see you. And then Bernadette, we've already met, right? Bernadette, are you there?
Yes, I'm here. You met me.
Yes, we've already met. And then Roberta, I've known for what, 20 years, Roberta? 25 years?
Yes, I'm here.
30 years now, probably.
Getting there. Yep.
Andrea?
Hello. How are you?
Hello. Good. How are you? Thanks for being here tonight.
Yeah, doing good.
Okay, Sandra? Sandra, are you there?
I am.
Okay, Sandra, we've already met, right?
Yes.
Yes, I know the pink. I love this might be strange, but I get to work with children all day at the University Hospital and in the HEMONC department. And sometimes I shave their heads for them, and I see the beauty. But when they shave your heads, when the heads are bald, the real beauty of a person's life condition comes out, and it really touches me in the heart. So, Sandra, you look beautiful with your hat on there.
Thank you.
Thank you Antoinette, you're welcome. Antoinette.
Hi.
Okay, you're in your car. You're driving around.
I'm here.
Are you an Uber driver or something?
No, I had to pick up my granddaughter. My daughter-in-law is in law school and she had a lot of homework and she's like, please help me tonight. I'm like, okay, I'll be right there.
Yes. Oh, that's good. So you're always in
yeah.
your car.
So they pull me in every direction. So yeah,
that's wonderful.
But I didn't want to miss the meeting. But I'm almost home. I'm 2 minutes away.
I'm hoping to have grandchildren someday soon. So.
Oh yeah, it's a blessing. I love her.
And Susan's your speaker's on. Off. If you everybody unmute their speakers.
Hello.
That way I can see you if you talk.
Hello.
I can't see you.
Susan.
Hello.
Oh, there's.
I'm unmuted. I'm not.
Okay. And Azalea.
Susan. Oh, there you are, Susan. Your screen was frozen for a second. Can you say one more thing?
I don't think she heard you.
Okay. Azela. Azela.
Can you hear me now?
Yeah, hi. I go by Zell.
Zell, okay.
If you can't hear me.
I can hear you, Susan. Okay, let's get going here. Hi, everyone. It's good to see you all. It's good to have you here. My name is David Lang. I work for the University of New Mexico, the hospital, and then the integrated medicine program, the Center for Life. There we have chiropractic, massage, acupuncture, medical doctors that are integrated medicine trained. We have had in the past Ayurvedic medicine and psych medicine there. We just have a new medical director after 2 years of not having one, and her name is Laura Medina. She's down from Colorado. She's actually a general surgeon who did a fellowship in integrative medicine. So she has this vast array of knowledge of doing surgery, but she also understands what integrative medicine is about. And I there am a massage therapist. I used to be the director of advanced manual therapies. I had a lot more responsibilities, but I wasn't able to see everybody that I wanted to there. So I went back and opened up 20 hours of my own practice. And that's where we're at right now. I'm here with Leanne. We've met several times. She's also a massage therapist, and she's taken a few classes with myself and my business partner, Emily Bruff, who is an acupuncturist, and she specializes in oncology care. She's very well known for it in the state of New Mexico. I am a certified oncology therapist, massage therapist. That's an advanced certification of 300 more hours. I'm also trained in visceral neuro work, and that's about another 1,000 hours of training. Those are both 3 years extra of training. And I also am a rehabilitation practitioner, which is a physical rehabilitation practitioner. I was able to work with a gentleman, Aaron Mattis, for 2 years, traveling the country, working with athletes and teaching other students. I do teach palliative and hospice care because that's my passion. I work with children. I've been working with children a long time, 29 years now, teaching them and then also working with them as a massage therapist. Fortunately, where I do work at the university, I work from anywhere in the emergency room with gunshot wound patients to little 2-day-old babies who are on crack or her parents are on crack, and I get to help them settle them down, and then all the way up to folks that are in their hundreds, from anywhere from cancer patients to tummy ache people. And that's what I am a specialist with, is tummy aches. And I'm going to show you this evening how to work on your feet, your own feet, or have your family members work on your feet for you. And then also, we all know with the drugs, the chemo care that we're on, our stomachs have a tendency not to be regular. So I'm going to show you a few techniques that you can use to help alleviate that. And also, yes, I'm having so much issues with that. Okay, it's a typical thing. They call me the poop master at the hospital. So I'm very proud to wear that hat. And my daughter-in-law actually made me a poop emoji hat in honor of that. I don't have it with me tonight because my wife wouldn't let me bring it. But anyway, I have a dance background in dance. I was a professional ballet dancer in New York City from the time I was started training there at 12 years old with American Ballet Theater, and trained at the Joffrey Ballet, performed all over the world, not particularly with those two particular companies, but different companies, and lived there and had my children there with. Actually, I didn't have my children. My wife had the children that we had together, so I can't take credit for that. But we moved here because my wife's family's from here, and I started massage 29 years ago. That's my background. What I would like to talk with you tonight is about what you might be going through and how someone like myself or someone who is trained in massage therapy can help you out. When I started practicing, massage therapists were not supposed to touch people with cancer. That was a misnomer. It's been proven wrong many years ago, but still there's therapists that I come in contact with who still believe that it's a contraindication to work with massage therapists, with people who are going through cancer care, whatever type of cancer they're going through. Even doctors have a tendency to still believe that old tape. It's old information. It's been proven wrong, and basic massage therapists are trained in basic understanding of working with folks that are going through cancer care. There are about 7 of us in the state of New Mexico that have advanced training in we're certified in cancer care. So those are the ones, if you have any hesitation, I can actually get you in contact with those people by just communicating to me or coming to see me personally. That's not why I want you to, didn't want you to be here tonight. I don't want to have to promote myself. That's not the point. I would like you to understand basically 2 things: that doing massage for people who are thriving through cancer is very helpful, especially after chemo or radiation, if it's done correctly. And it's just, first of all, it helps supports the immune system instead of breaks it down any further, because as you all know, going through chemo and radiation really messes up with your immune system. It also is very, the compassionate touch that's being expressed, it gives you an opportunity to just let the world slip by and do what you need to do for yourself every once in a while. And I find that people who are struggling with the different doctors, the different therapies you're supposed to be doing, people have a tendency to lose control of what they think control is of their lives, because everybody else is telling them what to do. In reality, it's your life. You're the ones who are going through it, the care, and nobody can take that away from you. And I look at that as a positive experience, that this is such a foundational pillar for you as a human being to be in society, and people can't take that from you. You know what it's like to go through this treatment. You understand, and nobody should be able to take that away from you, even though we don't want it, you know. So tonight, what I'd like to do is show you a few points, and I want you to ask me questions as we go along. I was diagnosed with Hodgkin's lymphoma when I was 20 years old, and I was given 3.5 months to live. And I told the doctors, go take a flying leap, because there was a lot of discussion about the fact that I was a ballet dancer. And when that time was 1980, and there was a lot of HIV positive, that's when AIDS came out. So a lot of the doctors just looked at me and saw my work background and said, oh, he's probably got HIV, he's probably got AIDS because he's a ballet dancer, which was very narrow-minded as far as I was concerned. I was like, no, I don't think I could get that, because I don't think my wife would do anything that I wouldn't do. But the point is, it was misinformation. And I, 40 years later, am still here. See, one of the first times I ever heard my father cry and say, Dave, come on home, because the doctors are giving you 3.5 months to live and you need to come home. And I was like, no, I'm going to fight this out. So I understand what fighting is all about from my life firsthand. And because of my experiences with the children in that, a lot of times people say, oh, don't give people false hope. And I was thinking about it today, because I was just working with a young lady who had a 20% chance of survival rate for her cancer. And I had a beautiful conversation with her last week, just to give her a little hope, because they had just told her in the morning, and the doc sent me in there to kind of pep her up. And I walked in, and the mom was combing her hair, and they had just gotten the news, and there's this big clump of hair on the bed. And I looked at the mom and I said, "Hello, my name is Vidal Sassoon. Can I help out in any way?" And the kid had no idea who Vidal Sassoon was, but the mom did. And it made the mom laugh and smile so much it broke the tension in the room. But just this week, they found out it was a wrong diagnosis. So now she has 10% more of a chance to live with the cancer that she's been given or that been reported about. So to me, that's hope. And it wasn't false. That's real hope. And that's what we have to do for each other, is keep the hope high. So you want to get on the table? Okay, let's get on the table. Just a little bit background about massage itself. Massage is the oldest touch therapy is the oldest form of healing. In fact, 10,000 years ago, they found, no, 5,000 years ago, they found petroglyphs in, yeah. On top is good, unless you're cold. Get on the they found petroglyphs of people doing touch, and that was a symbol of healing for them. So the great thing about this is that you can do this yourself. You can have your family members learn how to do this, and it's really comforting. And it also helps with pooping. Who is that? Zella? Is that right? You're the only one that I'm seeing right now, so I'm watching all of your facial expressions to see if I'm going in the right direction. So what I'd like to do is show you the foot. This is the big foot. So when I am actually working on someone, I'm using all these different types of oils. There are Vedic oils that I get here in town. They're from Banyan Oil Company. And I say this because we use this all over the industry, and it comes from here in Albuquerque, which is really cool because these two young men who are my age now, who are not so much young anymore, started this back in the 1991, 92, and it's an international company. And they are also, they help companies or farmers all across the world to develop crops to support their company, and they're a fair trade company, and they're here in Albuquerque. So I'll use a maha oil or sesame seed oil or brahmi oil with coconut in it, and these are good. These are liquid medicines for the body. So I use them, and then I also use a nice warm rock when I'm working on your feet. So I'm going to just show you here. As you can see, can you see that? Can you read that at all? Anyway, this is the stomach point, which is right underneath the big pad of your big toe. So working that, and then all around here, the outside, you can see where the large intestine's at, but this is the hips. And you can tell, if you can get online, there are downloads of this that you can actually print out yourself and see what you're working on as you're doing it. So I'm going to take 5 minutes. And if anybody wants to ask me questions while I'm working on Leanne's feet, please ask me, okay? Let me get my stuff here. Oh, I didn't turn that on. Okay. I didn't turn the hot rocks on, so I'm not going to use her on her feet, so sorry.
David, if you're open to a question, this is Allison.
Yes.
So the pillow is great because it really helped to show where those points are. In some cases, we have two, right? 2 hips, 2 lungs, 2 whatever.
Yes.
So does the right side, right foot correlate with the right hip and vice versa? Or
Yes.
how does that work?
Yes, it does. Answer your question? Yes. So, but when it comes to the stomach and the abdominal area, we know that the intestines go all the way across. So you're not going to miss on either foot working on the abdominal system or the GI system. I'm sorry. But you can see here, this is the right foot. and this is the left foot, right? So they are correspondent with each other. I don't know. I never.
Well, I guess.
Anyway.
Like if you think about like the liver is on the right side of the body, so there's liver points on the right foot, but not on the left foot.
Sure.
Or the spleen would be on the left foot, corresponding with that side of the body. But otherwise, it's fairly symmetrical.
It's very symmetrical.
Yeah.
And Allison, I got kind of your screen is just still, so I'm like, oh, there you are. Okay, now I see. My brain just went. What was that?
I just didn't want my screen to be distracting while I was asking a question. I apologize.
No. I that's why I lost my train of thought. I was like, going, where'd she go? Okay. Did it answer your question?
Super helpful. Thank you.
Here we go. So you can see here, right underneath the big pad here, this is where the stomach points are on the right and on the left, because the stomach crosses midline. The midline is when you the little loop in the stomach, it goes all the way up to the midline right above the belly button. That's where the pylorus is at. So that's where it starts in the small intestines and go across and down. 27 feet later, you're in the large intestine, which comes up and goes over. So anywhere in this section of the foot, can you see that? You're going to be working on stomach point or gastrointestinal points. And a lot of times what will happen is you'll feel a little bumpiness there, and people call those the little crystals in the body. This is fascia. Fascia is a saran wrap of the body. Everything in your body has fascia wrapped to it or around it. Underneath the third layer of skin is where the fascia starts. And fascia actually starts being developed after the 3 days to 3 weeks. This matrix of the baby starts forming, and that's fascia. And within that, everything starts developing and growing. And that's how we get to be who we are. So these are hard points of fascia. These are end points of fascia at the feet. So as I'm working this area, I'm actually having an effect on the abdominal area or the GI system, because that fascia goes all the way up on both sides and goes and wraps into the organs of the body. It's the same fascia. That's why I call it the saran wrap. Do you like that? Okay, Allison, you're smiling at me with this picture. Are you there? Oh, there. Okay. Hi. Who is that? That's Andrea. Andrea or
Andrea? Yeah, Andrea's good.
Andrea? Do you have a question?
No, I'm good. I'm
Okay.
just watching.
So this is the maha oil. And I spend about five minutes on each foot. And then I'll go right up the leg. And there's all these different acupuncture points in the leg that have an effect on the GI system also. Does that feel okay?
Mm-hmm.
Are you sleeping yet?
Not yet.
Okay. Ah, that's what's going on right there. Feel that?
Mm-hmm.
This is when you fell off your tricycle when you were 2 years old.
Mm.
Okay. So it's that simple. And the thing is that you can pick your foot up, cross your knee over your leg. I'm sorry. There you go. And you can work on your own foot if you want. Or it's always really nice when someone else is working on it for you, and give them an opportunity to do it. So there's many different YouTube videos out there that will show you how to do this. And this stimulates the stomach and the abdominal and the GI tract. So now what I'd like to do is show you actually working on the abdominal area. And can you turn around this way? So we know how the stomach is. Just come over here and sit for 1 second. Thank you. So we have the descending colon here. We have the stomach, we have the esophagus, and it goes to here. And from the esophagus, it's what's called the cardiac sphincter, and that attaches to the stomach. The stomach comes all the way down here, and sometimes a person's stomach can come all the way down into above the pubic bone. And that's called a ptosis in the stomach. And then it comes up to a little loop here, right above the belly button. And that's where it starts into the small intestines. And the small intestines wrap. And if you've ever seen a person's small intestines, they're actually really beautiful. They look like flowers. And then it comes. I know. What's that?
Not the only one with meetings.
What's that? And then from there, we go into the large intestines all the way across the ascending colon, the transverse colon, back into the descending colon. So you can do this to yourself. What you need to do, and this is also the same concepts of lymphatic drainage, is that we want to start basically at the end point. So that's going into the rectum and into the anus. We want to stimulate this area right here. And just slowly, you okay with this? Just nice and easy with your oils. I'm doing this over her clothing, obviously, so I'm not getting full results here. But just nice and easy. And we just stimulate that so there's a place for all of this to go. Because if we did this, there would be no place for this to go. This wouldn't be opened up yet. So then we come over to the right side, or the ascending colon, and just stimulate that. And you'll start feeling a rhythm or peristalsis happening. And we start nice and easy, and then we go up and over the transverse colon, and then back down to the descending colon. And we do that several times. So you're actually stimulating all of this area. And I know I think you've had Shannon goings here before, Allison. And she talked about lymphatic drainage.
Yes, Shannon was our November lecturer, and she did.
Yeah.
She showed everyone how to do their own lymphatic massage. It was lovely.
So this is very similar to a lymphatic understanding. Like you always want to open up the watershed and the abdominal watershed, and then move up superiorly to inferiorly move up. You're doing the same thing. You're not only working the intestines, you're actually working the lymph system here while you're doing this. Does this feel okay? Yeah, good. Good. Ta-da, you're done. And it doesn't take long. That's the thing, is that a lot of times people want to do deep tissue work. First of all, if your platelet counts are below 150, we all know platelet counts and what that means, right? Does everybody? You all know what that means, right? So, I'm just reading something here. If the platelets counts are under 150, you don't want to do deep work, because what that does, it bruises your body because your platelet counts are low. And it also brings down the immune system in the body. So I don't want to have you struggle any more with your immune system by giving you a massage. Okay? I just had a thought. This is what happens. Anyway, there's a question here. Yes, I've been having so much issues with my toes and fingers. That's chemo. That's having neuropathic pain. What you can do with that, and this is what I wanted to tell you, is that soaking in Epsom salts and apple cider vinegar, either in a full bath or in a pot. I'd say a nice Italian pot. You can soak your feet in that. And what you want to do in the pot is do half a cup of Epsom salts and a quarter cup of apple cider vinegar. You might smell like a salad, but that's okay. And then if you want to do a tub, so do 2 cups or a pound, actually do a pound of Epsom salts and a half a cup of apple cider vinegar and soak in the tub for no more than 15 minutes. And make sure that somebody knows that you're in the tub so they can come and check up on you. Okay? As far as deep tissue massage, I don't do deep tissue massage on folks that are thriving through cancer care because of that reason. You can really mess up the immune system, and I don't want to do that. I had a patient who had leukemia, and every time she'd come in, she'd always say, "Come on, Dave, do deep tissue on me." And I was like, "No, I'm not going to." She went off on a ship cruise with her family, and she did a deep tissue treatment with the therapist there because they never worked with someone who had cancer before. And she came back and said, "Now I understand why I'm not supposed to do deep tissue." So Bernadette is gone. Thank you. Bye, Bernadette. So any questions? Anybody want to ask any questions? Please ask me questions. I can answer questions.
Yeah, this is Sandra. Can you hear me okay?
I can, and I can see
Thank you.
too.
Good. So currently I am undergoing chemo treatment. So I have this week and then I'll be off for a week and then 3 more. But I do have metastatic breast cancer, and my main pain, I guess, my concern is on my back. I do have a tumor in my spine, which that's kind of what we're dealing with right now with radiation too. And just if there's anything that I can do with that nerve pain that I have. They do have like some meds, for me, but I do, get that kind of like a electricity kind of shooting pain wrapped around my right side. If there's anything that I can do at home, to kind of alleviate some of that.
Yeah, definitely. Do you stretch at all? Do you like stretching?
I do like stretching, yes.
I just had a kiddo that has osteosarcoma in their spine, and there's 3 fusions of her spinal column, and she was describing this same exact condition that you're speaking of. So what I had her do you mind if I show her to do the cat back?
Okay.
Do you know how to do a cat back? So
yes.
Go ahead and get on your haunches here.
Oh, I don't know if I can.
Okay, don't do it. Oh yeah. Okay, I'll show it. I'll do it. I don't.
Okay.
So it was her low back. But all I had her do in the hospital bed, even, I just said, just contract and go up. And if you know your body, if you need to divert from the actual stretch itself, divert from it and feel what your body feels good at. If it feels good just stretching one way or another, or even pulling out, don't do it on a high bed, a table like this, but
right.
Something like this would really help along the spine, because what's happening is that you're stretching those paraspinal muscles all along the back, and that'll help out tremendously. Or another thing is real simple, is just even when you're sitting, putting your arm over your head, turning and moving into it. That'll help that nerve pain a lot.
Fantastic.
Try that. Go ahead and try that. Go ahead, bring your arm up over your head. Now turn into the opposite leg and bend into it. Is that okay?
It is, yes.
You feel that
that feels really good.
Yeah. So that's real simple.
It is.
Sorry, I should have gotten my
Oh,
water.
thank you. I'm going to keep doing that. That's great.
Yeah. You know your body better than anybody knows your body. You all do. Your body has all the chemistry in the world. It's a warehouse. It's a storehouse of information. Play. If your body's acting up, how do you counteract that from acting up? And you can do that by stretching, by movement, by meditating, by anything that you come up with. You're the geniuses of yourself. I can't stress that more. You know, we have so much information. It's just that people are just trying to support us from the outside. So try that. Okay, thanks for that question.
Thank you.
And you're more than welcome to come and see me.
I think I will.
You know, folks that are going through cancer treatment, if you get on my schedule, go as a child, because that's the cheapest price. And I never charge anything that you can't afford. So, and that's the conversation that we'll have, but just go in, and that shows me that you're coming in for a different type of care. So if you see my website in that, put in for child, it comes up pink. So,
okay. Pink.
Yeah.
Like me.
Okay. Thanks for the question. Any other questions?
David, this is Allison. I just
Hi.
wanted to thank you for putting so much focus on the fact that for each of us, this is our own journey. It's a big piece of what we do at Pink Warrior House, is really encouraging people to advocate for themselves. And, you know, there's so many things when you're going through cancer that you don't have control over. So to own what you can and exercise some choice in that, you know, I think is really imperative. And it's been beautiful to see a lot of our women really embrace that and, you know, really take more ownership of their journey and give them permission to do that. So thank you for extending that permission.
Sure. And you know, who am I? I'm no one. And I've just been someone who works in the industry. And the ones that I really appreciate in my industry are the ones who advocate for that person's, for people's own journey, and to really seek out what this means. Because if I see so much trauma in my daily life, and so much misunderstanding of what people can actually do for themselves. And that's because nobody gives them the go ahead to say, hey, if you just do this, you're going to be able to hold on to this and make it your own and develop something that you never knew that you could do before. And knowing firsthand of what it means to go through and thriving and living through cancer, I had a totally different life before I had cancer. I was a Broadway dancer. I was a ballet dancer in New York City. Now I'm a massage therapist in Albuquerque, New Mexico, and I actually found my niche in life. And I just think it's an opportunity to discover yourself that much more. So that's about what I have to say.
That's beautiful. Thank you.
So, any other questions? Oh, come on, there's questions out there.
I have a question.
Yes.
So when you were talking earlier about massage, you said that it was okay to get a massage as long as it wasn't deep tissue. The reason I ask is because I was given a gift certificate to Betty's Day Spa.
Sure.
And I've been so scared to go, one, because of COVID, and two, because I just didn't know whether or not it was okay to do. And so it would be like a 60-minute massage. And so you're saying that that would be okay.
At Betty's is one of the best places in the state as far as I'm concerned. They're really wonderful, highly trained therapists there. The management is very educated. The lady who owns the place is a massage therapist herself. So she makes sure that her employees are trained, and she actually pays for her employees to get trained every year in another form of massage. I would ask, if you do call Betty's and say, I am a cancer thriver, I'm going through cancer care right now, I need a person who understands how to work with cancer patients. And they will give you, or they will suggest to you, this is the person that you need to go see. Okay?
Awesome. Okay.
A lot of those people that I've actually had the experience to train them. So they're good people. The fear, especially with COVID right now, we were all concerned If the person is masked up, if you don't have COVID, the therapist doesn't have COVID, you should be fine. It was really interesting. They closed us down, our clinic, for almost a month, but I was actually working in the pediatric ICU that whole time. And I was like, how can I work on the most vulnerable people in our state in the ICU, and I can't do what I do in our clinic? And it was a misunderstanding. We have learned on what we can and can't do. During my treatments, first of all, I gel my hands and clean them every time, obviously, but I also ask the patient of mine that's in my room to wear their mask while they're in my room, and I start them facing up, and then I create a little cocoon with the pillowcase, so they can actually move their mask off their nose, so they can actually breathe when they're facing down. They're still protected. I still have my mask on, and I ask them before they get on the table, after they've taken their clothes off, to gel their hands also. And then I say, please don't gel your whole body, just your hands, and you'll be fine. So, and I haven't had any problems, and I've worked through this whole time, and I see 4 or 5 cancer patients a day. So no worries there. But good question.
David, I had another question. You had mentioned your website for people to go on there and inquire or schedule or whatever. Could you maybe share that information or that site with everyone?
Sure. And there's a great question also that I'd love to answer. I've got, so my website is davidmlang.com. It's real simple. I wanted it real simple. You can go on there, and it gives a little bit of background of who I am and all the different techniques that I do and everything. And it's real simple to schedule. But I really want you, anyone that's on this call, if you do schedule, do it as a child, because that's the cheapest rate. And we will negotiate from there if you need more of a break, because I know firsthand what it's like with finances when you're going through this. But I just want you all to be taken care of correctly. I have a question here that says, I love this treatment for my own chemo-induced GI issues. I'm having surgery in 2 weeks. Could this foot therapy be done right away after surgery? My surgery is bilateral, simple mastectomy. Could you enter his website in chat? Okay, so that one was taken care of. Yes, you can do foot therapy. You're not going to disturb anything, especially after surgery. Good question. That's why I always start there. I can usually feel how the body's doing, and we take it from there. And any therapist that understands your situation should be able to do that. That's how we're trained. Can you repeat the child thing? So in my website, when you go on there, it has 3 different scheduling places. One is for adult care. That's anyone over 18 years old. The other one is for senior care, and that gives you a $10 discount. And the other one is for child care, and that gives you a $30 discount. I want you guys, ladies, sorry, to do the child care, because just put yourself in there as that, and that way you get that discount. Does that make sense, Allison? Yeah.
Yes, it does. And David, do you want to look at the chat? I think I put the website in right. It was davidmlang.com.
Is that right? Sorry. Excellent. Okay, thank you so much. Excellent, thank you. Okay.
Her chat didn't show up for you.
Your chat didn't show up to me.
Oh, okay.
Isn't this fun? Susan, thank you. Love, bye. I think that's what that means. I don't know. Yeah, it's just davidmlang.com.
Say M like Mary.
Try
And-
that, David. It looks like I responded to Susan's message
Yes.
directly, so I just copied
Remember
and
to
pasted it to
register as
everyone.
child below. Yeah, that's right.
Okay,
Good.
got it.
Okay. Any other questions? I hope this was helpful for you. Yes.
Okay, I have one question. So when
You're home.
yeah, I made it. I'm safe. When I go to massage my feet, is it okay to use lotion or is it better to use the oils? Or does it matter?
It doesn't really matter. Whatever's comfortable for you, whatever you have there. The reason why I use the oils is that because they're high grade oils and they're actually designed for what I do. And it's really healthy for your body. If you yeah.
So what was the name of the company again?
It's called Banyan Botanicals.
Okay, I found it. It's the BANYAN Botanicals. Okay, got it.
Okay. Is that good? Yeah, and it's really good. The Brahmi coconut is good for after radiation and because that helps out with the heat. Brahmi regular is good for calming the body down. The Maha oiled MAHA Naraya is good for bone and muscle pain. And then the neem oil, and this is really important, everyone. The neem oil, if you mix it with sandalwood and just little bits of it. So if we have a 2-ounce bottle, you take about 16 drops of sandalwood oil. It's good for scarring. It's really good, especially if you've had a mastectomy or any type of surgery done. It's really good for the scarring, and then it breaks up the scar tissue underneath the top skin. And can you see that? Neem oil, NEEM. And then it also is good for coloring or discoloration of skin.
David, would you mind terribly jotting all that down? And I'm happy to share it with the group. That was a lot of information that I think could be really helpful for different thrivers at different stages in their journey.
Yeah, sounds good.
Please.
Yes, please. Okay, we'll do that.
Okay, I have a question.
Yes.
You mentioned the neem oil and scarring.
Jerry. Hi, Jerry.
Yeah, can you see me there?
I can see you.
Okay, I had just a lumpectomy, but they took out some lymph nodes. And so of course I'm tight under my shoulder, when I move my arm around at certain positions. So would that neem oil help in massaging those muscles to loosen them up?
I would use the Brahmi for that. The Brahmi oil for that.
Okay.
Because the Brahmi is designed for relaxing that. If it's painful, it's the Maha oil. The neem oil is for the scarring. Did you say you have scarring there? I'm sorry.
Well, I was assuming that there's scar tissue inside or adhesions or something, that's, I have pretty good mobility, but there are certain positions that just are really tight when I get, this one.
When you, when did you have the lumpectomy done?
Last March.
Oh, you're doing really good. That looks great. That stretch that you were doing there did someone show that to you?
Well, I do yoga and I do stretching. So
Yeah, that's a great stretch. Another one is just taking your arm back like this up against the wall, and you'll get another pull like there, through there. Yeah.
I have pretty good mobility. It's just that in certain positions it's uncomfortable and sort of, feels like
and that's where Shannon could help you with that, or I could help you with that. We're both trained to work on what's called cording.
Okay.
And we can help you with that.
Okay.
But you're doing everything you're supposed to be. I think the oils will help though, and putting them on consistently every day, but you don't have to use much of it, very little of it. So what I'll do is I'll go ahead and put a list together for everyone tonight, and I'll send it to Allison, and she can pass it on to you all if that's okay.
Sounds good.
Sounds good.
Thank you.
You're welcome.
David, can I ask real quick regarding that list? Oh, sorry, we have a visitor. This is my 5-year-old Atticus.
Hi, Atticus.
Hi, Atticus.
I love
It's
you.
good to see you.
So
Hi,
is
Yes.
it okay? Like, let's say you have an area where you have scarring and pain. Is it counterintuitive to mix the oils?
That and the way I do that, I know this is strange because I'm an oil guy, is I smell. And you can smell the maha has 27 different herbs in it, and the brahmi is just brahmi oil. There's no reason why you can't put those together, because the base of the maha is brahmi. The neem, this is a great question because I'm the oil guy at the hospital, so people call me in all the time about essential oils. And I'm sure you've had essential oil people on here. A lot of times research doesn't indicate what's to be used in a high, I don't say, like hospitalized care. It goes to, there's some that's being used in emergency rooms now, but for the people that I see within the conditions that I work with at the hospital, a lot of times people put pure essential oils on the body. And I always give a story about if you have 5 pounds of broccoli, we all know broccoli is good for us. But if you took 5 pounds of broccoli and ate it all at one time, you would probably get sick from it. So when you use, especially when you're going through care and chemo care, when you're using oils, put it in a carrier oil. Now, diffusing it in the air is perfectly fine, but put it in a carrier oil like a brahmi or a coconut oil or even a baby oil. That way, you're not infusing all of that information into your system and overloading it with it.
Okay.
Does that make sense?
Yeah.
Yes, for sure.
Yeah.
Okay, I think I missed something. What is brahmi oil? What is that?
Brahmi is brahmi is an herb, like a, what is brahmi? Brahmi is like
Plant? Is it a plant?
Yes, an herb, a plant. It is a plant. And so they take that. I think that one is either in China that they grow it or in India. And I can see that they actually have small communities in there that they actually get their plants from. It's a really great company. So, but on their site, on Banyan's site, it'll explain to you everything.
Okay. Thank you.
Thank you, David. Thank you, Allison. Got to run. That's Susan. Bye, Susan. Any other questions? It's 6:28.
Well, I booked an appointment with you already on the 29th. I'll see you then.
Oh, great. I look forward to seeing you.
I look forward to it too.
Hot rocks ready for you too.
Okay, perfect.
Oh, good.
Good.
Sorry,
Internet-
David, Allison again, I'm full of questions.
Okay.
So, you said, have we had an essential oil expert on here? We haven't, because we just started the lecture series back in November, but I think that could be a really interesting addition. And
Yeah.
I wondered if you had anybody in particular that you really trust or recommend as an expert in essential oils locally.
That's I'd have to do a little research on that. I think Emily Bruff wrote. Roberta, what do you think about Emily? Emily defers to me on different smells and text smells when we.
Oh, that's the one question I put on the chat. We were talking about getting an acupuncturist also, and wanted to see if Emily would be interested in coming to talk with us.
I'm sure she would.
Yeah, can you
ASAP.
ask her? Yeah, ask her, and then also give that information. She can, call Allison or talk with Allison about getting a time.
I truly believe in essential oils, but I'm leery because a lot of them are a pyramid structure as far as distributing is concerned.
That was my concern as well. I didn't want somebody coming in and trying to sell doTERRA to all of our thrivers.
Yeah, and not that it's not a great product. It's just that, and a lot of times the people that are selling it are not seeing what I see and also what you're going through.
So David, do you want to come back and do another lecture with us on essential oils?
I'm not, I wouldn't consider myself an expert at that level to really give you that kind of information.
Okay. Well, I'd love to connect with Emily about acupuncture at the very least. And if you can think of anybody that you would consider an expert in essential oils, we'd love to loop them into the lecture series.
Okay. I'll work on that.
I appreciate it. Thank you.
That would be great.
I hope you could see my smile the whole time. I'm smiling at everyone. So, okay. Was that okay for you all?
Yes, thank you.
Sorry it wasn't too organized. Like I said, I'm usually with the whole group, and it was just me tonight, and well, with Leanne, obviously. But thank you for letting me be a part of this, and if I can do anything for you, even if you want to call and talk with me, or if I can give you any kind of direction, I'm more than willing to do that. And I'm willing to work with you with whatever you need. A lot of times, and I've been so fortunate with working with the folks that I work with, especially with women with mastectomies or breast cancer, I'm usually the first man that has actually worked or touched them in the area where they've had surgery. And I know that husbands have a hard time with it. And a lot of times I'll be able to talk with the husbands or the spouses of the folks who've had mastectomies and that, because there's a fear factor in that, and there doesn't need to be. So I feel very fortunate, and I really feel fortunate for you to let me be a part of this conversation tonight. Thank you.
Thank you.
David and Leanne, thank you so much for sharing your time and talents and knowledge and expertise with us. It was really lovely.
Yes.
Thank you.
Bernadette, I think you asked. Yes, I will send this to our techie volunteer and ask her to get it up on the YouTube page.
Yay, thank you.
Of course.
What was that? Oh, the information?
No, our lecture tonight, to get that up on it's our private YouTube page for Pink Warrior House. Oh. But sometimes if people can't make it, or if they want to go back and rewatch what you did, and, maybe follow along to do their own abdominal massage, it gives them the opportunity to do that.
Okay, good.
So
are you okay with that?
Yeah. Can I make a suggestion? What I was thinking, David, too, maybe to come back and just do a lecture on stretching and show us some of the stretches that we can do.
Actually, you can go to my YouTube site.
Okay.
Because I do have a 30-minute YouTube site that's actually for a therapist, but you can go and grasp a few things on there. It's called David Lang AIS, Active Isolated Stretching.
Okay.
And for $9.95, no, it doesn't cost anything.
David, do you know if it's something that I could copy and paste onto our Pink Warrior House YouTube page? Yeah. Okay, guys, I'll work on that too. So then we'll add it to our library. I have
999,900 more hits to go. So go ahead and hit it as much as you want.
Very good.
Okay. Thank you so much. Any other things? Anything else? No.
Thank you again.
Bye. See you all later.
Bye. Thank you.
Thank you. Bye.
Thanks again, David.
You're welcome. And I'll send that to you at least by tomorrow afternoon.
Perfect. This was wonderful. And I'm so glad we had good attendance and everybody was really engaged. And I just want to
hope it was explanatory enough. So
it absolutely was. It was wonderful. We only started the lecture series in November, although we've been virtual since March. And gosh, I just wish we thought to do it sooner, because it's been really awesome and everybody's responded well to it. And if you can think of anybody else too, I mean, we had Shannon on last month. We had Yolanda Cassius Salazar. She's a Western medicine herbologist who works out of Abiquiu. And she talked a lot about xeno and phytoestrogens in our food and our environments and those kinds of things, since so many women are dealing with estrogen receptor issues with their breast cancer. And then, of course, you were this month. But if you can think of anybody else that you know, colleagues or people in the field that you think would have something that would be of value to share in a lecture, I'd love to reach out to them.
I will, definitely.
Okay.
Thank you.
Thanks again. Take care.
All
Thank
right.
you, Anne. And best of luck on your journey.
Thank you.
You're in good hands, I can tell.
Thank you.
Yeah. Thanks,
Take
Al.
care.
Bye-bye.
Bye.